Halloween, it's at the end of this week. It is a fun time for kids and adults alike, but injuries and illnesses, well, they just kind of go along with the territory. So Dr. Vondra Brimage with Cone Health Urgent Care at MedCenter Mebane is here to talk about some common Halloween-related injuries and then what we can do to stop that. So this time of year, what might not be on top of mind for people that maybe should be?
Oh, thanks. Halloween is definitely one of my favorite times of year as well, but there's definitely more bumps, scrapes, and surprises that come through the urgent care. So that's really a great question. Around Halloween, we tend to have injuries related to pumpkin carving, sprained ankles, and where you're walking and you trip on the sidewalks or uneven pavement, or your costumes is a little bit too long and you trip over that. You also see some minor burns from candles or cuts from decorations. We see eye injuries when we have kids that play with swords and wands and they're poking each other in the eye. We also can see where people wear the glittery eye makeup and you rub your eye and it kind of gets in your eye and it scratches your face and it scratches your eye and it causes irritation. And then one of the most easily overlooked things is dehydration. Some of the kids can run around for hours and adults playing and having a good time, and you can easily get overheated even when the cold weather is here, as we do have in the last couple of days, pretty quickly.
Okay, a whole bunch of parents and grandparents and stuff just listened to all the things that could go wrong with glittery eye makeup and wands and went, oh my gosh, I thought I was doing a safe Halloween costume, right? But we got to wear the costume. We can have all of those things. We just need to know what to do to avoid those things and then what to do if something like that happens.
Well, for sure, since we started with the glittery eye makeup, so anytime you have any eye makeup, people like to put it here and under here. If we can put it at least a centimeter up to an inch around the eye instead, you would be less likely to rub it directly into your eye and cause an irritation or something called a corneal abrasion, which is just a scratch of the white part of your eye. Now, for as far as burns and things like that, try to use battery-powered candles instead, and then instead of real flames that are used inside of pumpkins. And if you are going to dress up for Halloween, get a costume that actually fits properly. Try not to have anything that's blocking your vision or anything that's too long that's going to make you have a trip hazard. Then
Gotcha.
the other thing is when you're carving a pumpkin, have the adults do the cutting. Don't try to do the cutting as a kid. Let the adults handle the knives. And then let them design and scoop out instead. And then if someone does get hurt, wash that cut or wound with soap and water, apply a little antibiotic ointment, and then cover it with a clean bandage. And if you do hurt yourself, unfortunately, you sprain your ankle or you twisted your ankle, now we need to practice the rice method. Try your best to try to do the rice method, which is R for rest, I for ice, C for compression, and E for elevation. So the rice method. And then lastly, if you do get swelling, bruising, or have some form where you feel like you can't move it quite right, that's the time to see the healthcare professional.
Okay, this is good to know when you can do it at home and then when you need to go find somebody. Okay. Candy, trick or treating, they go hand in hand. I mean, that's what happens, right? We're all yelling for the candy. But now there's like food allergies that may be a big concern. Let's talk about what kids and adults should know when it comes to like the candy and the food allergies.
So for candy and food allergies, especially this time of year, candy can be processed with things that we really could be allergic to if you have those certain allergies. Nuts, dairy, and gluten are always sometimes present, well, excuse me, sometimes present in candy. So you need to be able to look at the treats and know what's in them. Turn it over, look at the ingredients, ask those who made them, hey, what's actually in this? Because it could have been not only made with those things, but next to those things. And that will cause a issue as well. Now, if you start to have any swelling or trouble breathing or hives or a rash, anytime you ingest something, then it's time to actually call 911. And if you already have access to an EpiPen or epinephrine auto injector, then use that and then call 911. And then there's something that's coming out that my neighborhood actually practices, something called a teal pumpkin project, where you actually can get pumpkins that are colored in the teal color, put it on your porch or put it outside, let families know, hey, Halloween is about treats. And there's different kinds of treats, the edible and the unedible. So you can get stickers and bracelets and glow sticks and small toys instead. And then that way you can manage those things a lot better.
All right, and that's some healthy kind of alternatives as well, the stickers and things of that nature that you can still use, but maybe not have to, have the caloric intake. How much candy is safe for one kid to eat in one night? I'm asking as the parent, right, and as the kid, both.
So really, it's dependent, right? And do you get to a point where you can have stomach pain, nausea, and even diarrhea if you eat too much? And that happens both in kids and adults alike. We've all been there. We've all had it as an adult. We also had it as a kid. If those things happen, be sure at home to focus on hydration. Eat, drink as plenty as water as you can, and then that actually will help flush out that extra sugar from your body, and you tend to feel better. But if something happens where you're like, oh no, it's still happening, let's start to eat those bland foods, the things we don't like to eat sometimes, rice and toast and bananas. Instead of those sweet treats and fatty foods that taste better, we need to wait on those and for at least 24 hours. But if you start to notice that you have some dehydration, signs of like, oh no, I don't feel like I'm making enough saliva. I'm not urinating like I normally do. I got more vomiting that's lasting more than 24 hours, or I start having diarrhea and I'm like, it's not getting better. Unfortunately, it's time to see someone like me
Okay.
at your local urgent care or primary care doctor.
Gotcha. Okay. We're talking more trick or treat and Halloween safety when we come back in just a few moments.